Good morning. So today I'm going to present on the topic of minimally invasive endodontics. My name is Mohammed Afrid and I'm from final year BDS. So basically the minimally invasive endodontics is a paradigm shift in root canal treatment that focuses on preserving as much as root natural tooth structure as possible, especially the dentin, to enhance the tooth's longevity, long-term survival and fracture resistance. This approach applies the principle of systematic respect for the original tissue to all phases of endodontic treatment, from diagnosis to restoration. This concept is often referred to as biominimalism because it dictates that all phases of endodontic therapy, from diagnosis to final restoration, should aim for the least amount of tissue loss necessary to effectively treat the disease. Coming to the core principles of minimally invasive endodontics, it majorly involves three things, and those are access cavity design primarily, and the second one goes in the canal shaping, and the third one is the restoration. So speaking about the importance of dental preservation in the fracture resistance, paradigm shift to minimally invasive endodontics is driven by a clinical understanding of dental biomechanics. So the fracture resistance, the removal of dentin, particularly in pericervical dentin area, that is the dentin around the neck of the tooth and the root canal orifices, severely weakens the tooth's resistance to functional forces, removing the roof of the pulp chamber and widening the access cavity increases the risk of tooth fracture, which is done in conventional root canals, contrastly, which is often the cause of the long-term endodontic failure. So, going on to the marginal ridge integrity, preserving the cusps and the marginal ridges of posterior teeth is crucial as they act as key load-bearing beams that keep the tooth intact under biting pressure. So, the marginal ridge and the cusp complex are shown in this picture clearly, which indicates the remaining marginal ridge and the cusps after access canal preparation. So the restorative treatment is depends mostly on the tooth, the most original tooth structure, a stronger foundation for the final restoration, ensuring a better seal and overall longevity. And this better success of the restoration involves three different things, whereas we choose the right material that has the adequate strength, adequate wear resistance, bond strength, restorative assistance, and the technique that is being used to do the restoration matters, whereas all these things contribute to the success of the restoration from the materials that we are using, and it also involves the patient and as well as the dentist to achieve the successful restoration. So moving on, there are three pillars of minimally invasive endodontics that is implemented across three main procedural stages guided by advanced technology. So conservative access cavity preparation. This is the most visible difference from traditional techniques, as reduced openings that follows the underlying pulp chamber anatomy. Common designs include ninja axis, minimal pinpoint entry, press axis, preserve the central roof of the pulp chamber and contracted areas. So basically in conventional endodontics, we used to do the access cavity preparations by deroofing the pulp chamber, and contrastly here, the deroofing the pulp chamber is not done, and also only the entry point is made so that it is minimally accessible into the tooth. It can highly impact the stress on the tooth, and stress applied on the tooth, and the tooth can actually bear the stress due to the large amount of remaining tooth structure. So moving on to the second thing, that is the conservative canal shaping and cleaning. The focus shift from creating a wide funnel shaped preparation for old filling techniques to one that strictly follows the natural anatomy. Lower taper files, that is in minimally invasive endodontics, we use the night high files with small taper, that is 0.2 or 0.04 or rather than 0.06 or 0.08, and smaller apical sizes. This removes less bulk dentin from the middle and the coronal thirds of the root, maintaining the wall thickness, hence strengthening the tooth. The disinfection trade-off, since less dentin is mechanically removed, minimally invasive endodontics relies more heavily on chemical disinfection like EDTA rather than on sodium hypochlorite. So, enhanced irrigation techniques like ultrasonic activation is mainly emphasized here, or laser activation are used to agitate the irrigating solution like sodium hypochlorite deep into the root canal system, ensuring bacteria are effectively eliminated despite the minimal shaping. The optimized obturation and restoration. The material in the final seal must be optimized for the conservative preparation. The bioceramic sealers are mainly used, which are hydrophilic, that is water-loving, and highly flowable. Their superior sealing ability allows them to fill complex canal anatomy and lateral canals effectively, even when the main canal shaping is minimal. The restorative protocols goes like: the final restoration is critical. The minimally invasive endodontic concept requires a bonded restoration to reinforce the remaining tooth structure, completing the circle of preservation. That is, we can go for composites as well as moving on to the technologies that is actually enabling us to practice minimally invasive endodontics is heavily supported by advanced dental technologies. The first one goes like the dental operating microscope, provides high magnification illumination allowing the clinician to see the fine details of the pulp chamber and root canal orifices through a tiny opening. Even the dental loops are also employed in this case, as the microscopes are heavily costly and are not practically owned by every single practitioners out there. So the next one, we move on to the cone beam computed tomography, that is our CBCT. This actually enables us to do a 3D imaging for precise preoperative planning, and also enabling the clinician to determine the exact location and angulation for the access cavity, thus reducing unnecessary dentin removal. This has been a significant improvement in the field of endodontics. Hence, it actually helps us to understand the anatomy of the tooth that is present in every single cases, and it is actually easier to locate the pulp chamber and do a minimal access cavity preparation. Going on to the ultrasonic tips, there are fine specialized tips that are used under the microscope for conservative removal of the dentin to locate calcified canals without aggressive drilling. Yeah, this not knowing whether the canals are calcified or not, and trying to work on that and making a ledge is far more dangerous than actually using this ultrasonic advanced steps to actually remove the calcified canals without any aggressive drillings. So the guided endodontics using a CBCT data and the specialized software, so to 3D print a template guide that precisely directs the drill to the target area. This is a very good software. I have put up a picture for that. This actually helps you to understand the anatomy and also the position of the pulp chamber, position of the pulp chamber along with its position, angulation, any kind of abnormalities, any morphological abnormalities can even be seen through this, so that it is precisely directs the drill to the target area, ensuring the smallest possible access opening. So this is all we have. This is all the advanced technologies that is being employed right now in the minimally invasive endodontics. And that's all, guys. Thank you for listening, and have a great day.